Overall, 3 movements were analyzed in this practical, with the first one being walking on a balance beam. So walking on a balance beam is basically walking on a slightly elevated surface while focusing on bodily balance. So a normal walk across a balance beam would just include walking across the beam while balancing and not falling off of the beam. So the purpose of this movement, like I said, is to increase overall balance. There are 4 phases included in this movement. The first one is initiation, and this is where the body movement is initiated by lifting one foot off of the ground and flexing the knee. So the muscles involved in this movement are the gastrocnemius and soleus for plantar flexion, the tibialis anterior for dorsiflexion, and the quadriceps for knee extension, and also the gluteus medius for hip extension. The ankle and knee joints, which are hinge joints, along with the hip joint, which is a ball and socket joint, are all used and associated with this phase. In the second phase, which is weight transfer, the body weight is transferred onto the planted foot while maintaining balance. The muscles involved are the core muscles, which maintain a stable trunk, and the hip and lumbar spine, which allow for slight trunk rotation. In the swing phase, which is the third phase, the free leg is moved forward, allowing for the next step to be taken, and the muscles involved are the iliopsoas, the knee flexor and ankle plantar flexors, and the tibiofemoral, talocrural, and hip joints are all associated with this movement as well. The fourth phase is stabilization, and this occurs when the body is stabilized on one leg before another step is taken. So the core muscles, quadriceps, and ankle stabilizer muscles are all used in this movement, and the lumbar spine is used for trunk stability. The talocrural and tibiofemoral joints are also used to help with the weight bearing of the legs. And then the motor learning skill of this specific movement is balance and proprioception. So this occurs by walking on the beam, and it allows for a heightened sense of bodily awareness of the overall movement. And then for musculoskeletal terminology, for example, in this movement, the quadriceps originate from the anterior superior iliac spine, and they insert onto the tibial tuberosity. They extend the knee during weight-bearing phases. The second movement analyzed was throwing and catching a ball. So the purpose of this movement was to exchange an object, such as a ball, between 2 or more individuals, enhancing hand-eye coordination, spatial awareness, and motor control. So a normal movement of catching and throwing a ball is simply throwing the ball back and forth between the 2 individuals and successfully catching and throwing the ball without missing it or dropping it. So there are 3 basic phases in this movement. The first phase is the preparation phase. So in this phase, the deltoid muscles in the shoulder are activated and raise and abduct the arm. The biceps brachii contract to flex the elbow. The triceps brachii is engaged to provide stability and control during the throw. And then the pectoralis major assists in the forward movement of the arm. The glenohumeral joint abducts and flexes, and the elbow joint also flexes. And then in the second phase, which is the execution phase, the rotator cuff muscles stabilize the shoulder during the throw. The triceps brachii extend the elbow joint, propelling the ball forward, and the wrist extensors stabilize the wrist during the release. The glenohumeral joint internally and externally rotates, flex, and abducts. The elbow joint extends, and the wrist joint stabilizes. And then in the third phase, which is the follow-through phase, the latissimus dorsi and teres major contribute to the extension and adduction of the arm, and the wrist flexors stabilize the wrist during the follow-through. The joints include the glenohumeral joint, which extends and abducts, and then the elbow joint extends, the wrist stabilizes. And then the main motor learning skill in this specific movement is hand-eye coordination, which involves the integration of visual information with motor movements for accurate catching and throwing of the ball. The last movement analyzed in this practical was hopping. Hopping can be done on 1 foot at a time or 2 feet at a time. In this practical, we focused on hopping on 1 foot at a time. And then the purpose of hopping includes enhancing lower limb strength, also increasing balance and coordination. And the movement can be divided into several phases. So the main phases of hopping include 4 different phases. The first phase is the stance phase, And the muscles engaged in this specific phase include the quadriceps, which contract to extend the knee joint, keeping the leg straight during the initial contact. The calf muscles are also used to help get the heel off of the ground, and the hip flexors are used to engage and lift the thigh towards the torso. The joints involved in this specific phase are the knee joint, which extends, the ankle joint, which plantar flexes, and the hip joint, which flexes. The next phase is the takeoff phase, and the muscles involved in this include the quadriceps, which continue to extend the knee, propelling the body upward, the gastrocnemius and soleus, which help with plantar flexion and aiding in pushing off of the ground, and the hip extensors, which engage to extend the hip joint, assisting the lifting of the body off of the ground. And then the joints involved in this specific phase are the knee joint, which continues to extend, the ankle joint, which continues to plantar flex, and the hip joint, which extends. And then the third phase is the airborne phase. The muscles involved in this phase include the core, which stabilizes the trunk and the pelvis during the flight, and the hip flexors, which continue to assist in maintaining the thigh position. And then the joint actions include minimal muscle action in the lower limb during this specific phase. And then the fourth phase is the landing phase. So in this phase, the quadriceps contract eccentrically to control and bend the knee joint for a smooth landing. The calf muscles continue to control plantar flexion as the foot makes contact with the ground, and the hip flexors assist in flexing the hip to absorb the impact. And then the joints used in this part of the overall movement are the knee joint, which flexes, ankle joint, which dorsiflexes, and the hip joint, which flexes as well. And then the overall motor learning skills in this specific movement are balance, coordination, and proprioception. And these basically all allow for the body to have a greater sense of their position in space while also maintaining specific movement in the movement overall. This movement emulates walking on a balance beam. The rope represents the elevated surface. As I walk, my legs are mostly straight with a slight bend in my knee, and I am trying my best to not lead myself astray off of the rope as I walk. This example shows the individual movements of both catching and throwing the ball. When I catch the ball, my eyes move with the ball as it is released and caught into my hand. When I throw the ball, my eyes follow the ball as my arm forces the ball outward to the desired position. In this last example, I can be seen hopping on one foot. As I hop, my knee is slightly flexed and the weight is shifted to one side of my leg, specifically the one that I am hopping on. The movement overall is controlled as I hop up and down. This is Lily walking on a balance beam. Kinematically, she has precise control of her joint angles. Kinetically, the friction found between her feet and the ground allows for prevention of slipping. The lower extremities of her body, along with her arms, allow for a balanced movement, and the nervous and musculoskeletal systems work together to allow for her to use her limbs correctly as she balances. Proprioception allows for her to sense where her body is, allowing for greater movement awareness. She does a great job walking across the beam. In playing catch, kinematically, Lily's shoulders, elbow, wrist, hip, and knee joints work together to position the ball, release the ball, and catch the ball. Kinetically, the force generated by the muscles contributes to the acceleration and velocity of the ball during the throwing phase. The catching phase involves absorbing and decelerating the force of the incoming ball. Most extremities in both the upper and lower regions of the body work together to successfully play catch. Lily's musculoskeletal and nervous system work simultaneously to allow for stable movement, as her nervous system can help her recognize when she needs to catch and release the ball. She does a great job of both catching and throwing the ball. Kinematically, in hopping, Lily's ankle, knee, and hip joints work together. Kinetically, the calf and hip muscles work to control the landing and takeoff of the hop. The calf muscles absorb the shock of the force of the landing. The lower extremities move the body. The musculoskeletal and nervous systems work to sense change in force as Lily lands, helping determine how high she should hop along with how hard she should land. Lily exhibits great control as she hops on both legs. This is Lily performing the hand-eye coordination test. In this test, she caught the ball with one hand and threw it with the other hand for 30 seconds. Since she caught the ball about 30 times in the 30 seconds, she is deemed above average in the overall testing scores. This is Lily performing the 4-stage balance test. In this test, there are 4 different positions. The patient tries to stand in each position for 10 seconds. The first position is standing with your feet side by side. The second is placing the instep of one foot so that it is touching the big toe of the other foot. The third position is the tandem stand, placing one foot in front of the other with the heel touching the toe. The fourth stance is standing on one foot. Lily was able to stand in each of the positions for the 10 seconds, meaning that her balance is acceptable. Manual muscle testing of the knee was the last test that was performed. The therapist places one hand on the posterior thigh and the other hand applies resistance at the distal calf just above the ankle. The resistance is applied downward as the patient actively flexes the knee upward. Lily's manual muscle score was a 5. This score means that Lily was able to complete a full range of motion of her knee. The hand-eye coordination test was taken in relation to the throwing and catching motions. The balance testing was taken in relation to walking on the balance beam, and the manual muscle testing was taken in relation to the hopping motion.